This is Dr. Meyer. I'm a pulmonologist in Carmichael near Sacramento, California. Last couple of weeks we've been talking about blood pressure and how to maintain it, how to prevent it getting out of control. And today I'd like to talk with the overall management and helping you to prevent the emergency room visits. I recently had a patient that went to the emergency room 6 or 8 times in the last month. Every time her blood pressure got up, she would run to the emergency room. Now you have to remember the emergency room is a different set of doctors. I may have a file that's several inches thick on the patient and have all the information, all the background on that. And the emergency room would be a new doctor. It would be like starting out with me for the first time. Excuse me. And so they'll have different ideas. Every doctor has their own ideas. If you go to another doctor, then you get increasingly confused. I see many patients very confused on their medications. Some people say doctors are all prima donnas. They think their method of treatment is the best and the only way to treat. And so if you go to 5 doctors, you'll have 5 different ways of treating. I remember that when I was CEO of a medical group, 8 physicians, 8 pulmonologists, and every Monday morning we got together. And if I didn't watch where this discussion started, we could go around twice and you have 16 or 12 different opinions or 16 different opinions. And so and that's how a doctor is made. You give new evidence and he has a new opinion. And so same way with the clinical medicine, they will all have different opinions and none of them are totally wrong, or no right ones may be better than other right ones. But it's come down to, as I said last week, and the lisinoprils or the ACE inhibitors, the beta blockers, and from then you go on. So patients run to the emergency room, and the cost is rather striking. An emergency room visit is at least 10 times as expensive as a physician's office visit. And so the other way that I have patients maintain their own control is give them some ideas on what to take if their blood pressure got out of control. They get stressed out and the blood pressure gets sky high. It's not good to run to the emergency room. Emergency room visits in our area will vary from 2 hours to 6 or 8 hours. And during that time the pressure would just go off the boards. And so it's best to treat that ahead of time. If you're on a beta blocker, I tell my patients to take an extra pill. And if you rest for an hour, the blood pressure will go down. That's better than having the stress of the emergency room, the trip to the emergency room, and so on, and 10 times the cost. And if you stay in the emergency room, the cost will go up astronomically, from the basic $600 average charged up to $8,000 or $9,000 if they do more and more things. And that doctor in the emergency room will not have all the tests that were done in the office and the outpatient visit that filled up maybe 100 pages of my chart or 200 pages, and so much the duplication, which is expensive. And anybody who watches the news will know that the cost of healthcare is just gone out of sight. And so it behooves all of us to keep the costs down. And the best way is to talk to your doctor, and when you question your doctors about things to do and blood pressure goals, the blood pressure goals have been changing. It used to be 140/90. The insurance companies have used 135/85 for a long time. The cardiologists in our areas are shooting for 120/70 because the death statistics are much higher when you get up close to what's considered normal. And so many of the patients that come back from a cardiology visit, they're actually lightheaded when they get up out of a chair because the cardiologist has got pressure very low. And some people without high blood pressure are placed on lisinopril, which reduces the pressure a little bit, and because of a protective mechanism for their kidneys. They have diabetes or some other cause for that, and that's very important in diabetics to use lisinopril to protect the kidneys. So keep in mind to manage your own blood pressure. Don't run to another doctor, and emergency room doctors are a totally different perspective. You're being sandwiched in for something you should be handling yourself, between emergency rooms that are life-threatening, trauma that demand the emergency room staff's entire time for maybe hours at a time, during which time you sit there, and that's really not the place for you to get your basic care. and it's not the best care, and it's also very expensive care. Thank you for viewing us today, and we'll be back with you next week. And meanwhile, visit our website, delmeyer.net, and the YouTube videos are listed there for you to review, and my medical practice website, which is medicaltuesday.net.